Hello students, today we are going to continue with Unit 3 Yoga and Lifestyle Part 3, in which we are going to study about asthma and the asanas which are useful to cure it. Asthma is a disease of lungs in which the airways become blocked or narrowed, causing difficulty in breathing. The airways also swells up and proves extra mucus. It usually triggers coughing, wheezing, or whistling or shortness of breath. It usually occurs at night or early morning. The first asana is Sukhasana. It is derived from the Sanskrit word Sukham, which means delight or bliss. Sit down normally on the floor, stretch out legs ahead in front. After this, cross legs and broaden the knees in order to put both feet under the opposite knee. After that, bend knees along with fold legs. Keep feet loose in order that the external edges lay on the floor. Benefits: broaden collarbone and chest, calms the mind, enhances condition of peacefulness, minimizes anxiety, stress, mental tiredness, improves body posture, reduces fatigue, strengthens back. This asana doesn't have excessively numerous contraindication. However, person suffering from backache shouldn't stay in this position for over 5 minutes. Person suffering from knee injury is not advised to sit in this position for a long time. Chakrasana. The name of this asana is derived from an addition of two different words, that is chakra, which means a wheel, and asana. Lie down on the floor looking upward. Fold legs and keep it down below the hips. Make sure the sole of the feet touches the floor. Bring both the hands and keep it beneath the shoulders. Take a deep breath and keep hands and legs on the floor. Then slowly raise hips, shoulder and head from the floor. Then bend your back as much as possible. Stay on the same position for a minute. You can see in the image. Benefit: chest enhances and the lungs get more oxygen. It reduces the stress and tension. It helps in strengthening the back and increases the elasticity of the spine. It reduces the fat in abdomen area and tones the digestive system. It regulates the endocrine glands and maintains the metabolism normally. Helps in stimulating the process of the liver, spleen and kidneys. Contraindication: people suffering from diarrhea and hernia should avoid this asana. People having heart problems must do this asana after consulting a doctor. It is not safe for the pregnant women. People having pain in wrist, ankle and spine should avoid this yogasana as it may be harmful for these body parts. People suffering from hypertension must not practice this asana. Gomukhasana. It is derived from the Sanskrit word go, means cow, and mukha means head. This asana stretches several parts of the body simultaneously, including ankles, thighs, hip, chest, neck, arm and hands. Procedure: slide knees together in front and stacking the right knee directly on top of left. Sit back between feet, which should be equidistant from hip. Support weight evenly in the midst of the sitting bones. Extend left arm, then bring left hand down to the center of back. Reach right arm out of the same side and parallel to the floor. Then rotate the arm inward. Thumb will turn first towards the floor until palm faces above. Take a deep breath and while exhaling, sweep right arm behind and in the hollow of lower back. Keep spine long and hold hands behind back. Now release arm across legs and repeat Gaumukasana with the left knee on top and left elbow pointing down. Benefits: helps in relaxing a person, stimulates the kidneys, helpful in relieving ailments like diabetes, high blood pressure. It leads to development of the muscles of the lower back, hip and knees. It is beneficial for backache, sciatica and rheumatism. This asana should not be practiced in case of neck, knee, hip and shoulder injury. Don't go beyond over personal abilities. Parvatasana. It is one of the most seated yoga postures. As the pose resembles a mountain, it is called Parvatasana, a mountain pose. Firstly, sit down on the floor keeping crossed leg position. The legs are kept apart a little more than the hip width. Bring hands in front so that palms face towards the performer. Exhale and move hands overhead. Keep your fingers interlocked and hands stretch upwards. Pull torso in upward direction and stretch as much as high. Hold this position for a little longer and breathe normally. Come down in original position. Repeat the asana for about 8 to 10 times. Benefits: it gives a full body stretch, so it improves blood circulation, reduces mental fatigue and also improves memory and concentration, strengthens weak muscle of the body and prevents injury. It improves the health of internal organs, helps in reducing the respiratory problems like asthma, helps to prevent rheumatic stiffness and arthritis, helps in losing body weight. Contraindication: don't overstrain the knees. The neck should be kept straight to avoid any further movement. Avoid hunching of the back during sitting position. It can cause hunchback and stiff shoulder due to wrong way of doing this asana. Procedure, benefits and contraindication of Bhujangasana and Paschimottanasana have already been discussed in diabetes. Children, kindly go through the video again. We have discussed earlier. Matsyasana. It is derived from Sanskrit word Matsya, which means fish. Matsyasana is also known as a fish pose. For performing this asana, sit in Padmasana, then lie down in supine position and make an arch behind. Hold your toes with the fingers of your hand. Stay for some time in this position. It strengthens the muscles of your upper back and back of neck. It helps in improving postures and provides relief from respiratory disorders. Matsyasana also strengthens the spine and helps to prevent backache and pain. Contraindication: person suffering from hypertension must avoid this asana. Migraine and insomnia patient should avoid this. Individuals suffering from serious lower back or neck injury should not practice it. Thank you.